Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales, and today we're honored to have with us John O'Brien. He is a doctor, licensed psychologist, professional speaker, and executive coach in Portland, Maine, with an over 30-year career in the mental health field. He is the founder of two successful businesses and has held leadership positions in many professional organizations, including past president of Maine Psychological Association. John serves as an adjunct professor at the University of Maine at Augusta, teaching courses in psychology, trauma, and addiction-related topics. John equips people with tangible skills and concrete tools that empower them to swiftly reduce stress levels and concrete tools that empower them to enhance wellness as well. He is the author of the recently released book, Rudeness Rehab, Reclaiming Civility in the Workplace and Your Home Space. The reason why John is a great speaker today is one of the problems of private practice for physicians is staff retention. You spend a lot of time and effort and money training staff, and then poof, they're unsatisfied and they're gone, and you have to start the process all over again. So this is something that is dear to a lot of physicians in private practice, and you'll learn a lot of stuff today with Dr. John. Welcome to the show.
Thanks so much for having me, Dr. Hales.
The first question that people might want to know is, what is incivility? Now, we all may think of it as rudeness or a few four-letter description. But
Yes.
in terms of a professional viewpoint, what is it actually?
So as you said, people define it in various ways, but I think of it as inconsiderate or rude behavior that definitions say it violates norms of appropriate workplace conduct. Um, and I would sort of just simply say I think it's inconsiderate behavior that causes stress in the target of the behavior, in people that witness the behavior, and even ultimately boomeranging back to the person who is rude, her or himself. And I could give you some examples of what I mean by the um, uncivil behavior.
Well, unfortunately, all of us who are ultimately patients in doctor's office know already what that means. Uh,
Yes.
it could mean that from, the person at the front desk to patients that may not come with the appropriate documentation or who are showing up on the wrong day or who are late and therefore mucking up the schedule. Or it could be in terms of interstaff, where the staff is just rude to each other. Maybe
Yes.
one person feels that they have a higher status and could then boss people around, or who just happen to be extra tired or who are just naturally rude. So these are things that we don't want to encounter in a doctor's office. And maybe now that it's taken the death of the United Healthcare CEO, people might think twice.
Absolutely. Yes, about what their behavior is and the impact it's having on others. If I may, I would just add to the comments that you made. Absolutely, all those things are things that are quite unfortunately common in doctors' offices, and certainly in our office too, with patients being rude to staff, staff being rude to patients, staff being rude to each other. Staff can also be rude in um, electronic communication to clients or to staff. And another component also is something that's called victimless incivility, where it's basically people, this would be for staff, leaving a mess behind them that others have to clean up, like the photocopier being jammed or um, no coffee being left in the coffee machine, other things. Just those small acts that are seemingly inconsequential over time can build up to really create a toxic work culture.
Well, when you have that caffeine need, it's not such a small thing.
Correct, correct. As I have my caffeine next to me myself right now. Yes.
What prompted you to write a book about incivility? I know we all think about it, but people might say, "Well, how much can you actually talk about that?" And like, what would prompt you to write a book on it?
Well, I have worked with clients, as I said, for, over 30 years individually in my office to help them combat the negative impact of other people's behaviors. But when I heard Dr. Christine Porath speak in 2017 about her research on incivility and really saw the alarming statistics that she communicated about the negative impact it had on the work environment, it also made me think of my own dad, who had a massive heart attack when I was 15, and
Oh,
he was 49 and was an executive and was never able to work again. So that's kind of the backdrop to the motivation. And I'd had an awareness of stress management skills and had taught clients that for many years. When I heard Dr. Purath speak, it really brought those two areas of expertise together. And then you add in what we all saw going on in our culture in the pandemic. And that really is what I had been thinking about writing this book. And then that's really what pushed me to take the time to do so.
okay. So this brings to mind a question, which is, do most people who are seeking help on this, the victims of it, or do people who are rude actually recognize they're rude and want to change, or do the rude people feel, you know what, deal with it?
Well, I would say it's a mix. I would say more often people come to my office and they will talk about the rudeness of other people and want help figuring out how to navigate those situations. And quite often they are dealing with very hostile or toxic work environments. But at the same time, I do for them what my advisor in my doctoral program would do when I would describe my difficult interactions with other faculty members. She would listen as I was complaining. She'd listen very patiently, and then she would say, "And what part of this is about your behavior?" I always hated that part of it. But I do encourage people to reflect on, not that they're responsible for the rude behavior of other people necessarily, but for them to think about how might their behavior unwittingly be contributing to that and causing a reaction from other people. So
Do
in
most people
essence,
recognize that? Or do they say, oh, it's not me at all, it's just them?
well, sometimes people's initial response is defensive. But if people do return to my office after we have that conversation, most people do, um, that they'll say they thought about it, um, and that it just makes sense that I need to be mindful of my own behavior and the impact that that's having. And certainly for your listeners to this podcast, it's very easy to see the rude behavior of staff. But it's much harder as a practice owner, and I'm a practice owner myself, but it's much harder as a practice owner to step back and think about, okay, how how is my behavior contributing to the problems in the practice?
What is it that you do, to resolve this when you have a repeat offender?
Well, it depends upon well, first of all, is the repeat offender someone that's coming to seek my help? And in those cases, if they keep coming back, I'll keep working with them to try to help them change their behavior. If they are reporting to me about a repeat offender in the workplace, um, you know, when we've had a repeat offender in our work environment, um, the objective is to continue to call attention to their behavior patiently but directly to their behavior. We've never had to, in our practice, we have a small practice. We never had to sort of let someone go. But my experience is if you keep bringing people's attention to their behavior and keep making the consequence be, no, we need to talk about this, blah, blah, Well, eventually, sometimes they self-select to leave if they're not willing to change, or they attention that is given to their behavior ultimately causes them to change. Um, if I'm consulting to someone about somebody else in their work environment, it really depends upon is it a boss, is it a peer, or is it a direct report? And based on who that is, some of those solutions are going to be different.
How does it reflect on a doctor in his or her own practice if they do not call out this employee, but rather let them have free reign over their, expression of their personality?
It is very damaging. Statistics I've read, and I don't know how accurate these are, but it takes one bad review of a client to really potentially take down a practice, and you need 40 positive sort of clients, happy clients, who are then because not all of them are going to be writing positive reviews because perhaps only one of them will. So, um, a a toxic employee who is doing damage and I hear it all the time in my clients that they will say, I like my doctor, but I'm not going back to that office because I have to deal with this person. So it just and one person with who has particularly negative or uncivil behavior can really spoil the employee experience and that then it trickles down into the patient experience.
Sure. Correct me if I'm wrong, but I think that for someone who is mightily irked, that they have more incentive to go ahead and write a review than someone who says, well, I'm happy and like I'll eventually get to it.
Absolutely. Yeah. And that's why it takes, 40 happy customers, because maybe only one or a few of them will write something. And people are much more likely to write a complaint in Google reviews. And that's where people go now when they want to look at doctors and look at doctors' ratings, is that they'll go into some of those rating sites to see what's the feedback that patients are having. And if you have even a few writing negative things, it really can chase patients away.
Right. Well, what a doctor needs really to, have as an eye-opening fact is that when you get a review, a lot of it may have nothing to do with the doctor themselves. It has to do with the patient experience. So
Yes.
if you have, patients that come in that are having a terrible experience speaking with the billing department or who are approaching the front desk or who have just poor um, waiting room experiences, that all of this goes into consideration for ranking and review. And, while one might say, well, it really has nothing to do with the doctor, but in fact, it really does. Because it is, if it's a private practice, if it's a hospital, it's one thing. But if it's a private practice, then it really is incumbent upon the doctors who own that practice to make sure that it is a good experience and that both patients and staff are satisfied.
Yes, and it means really being open to critiques and criticisms and listening to patient complaints and taking them seriously and trying to address them. And when a patient brings it to you, not to dismiss it as, oh, that must be a sort of just a just a grouchy patient, that every piece of data is important to consider.
Which sites do you think are the rating sites that are viewed the most? Is it Yelp or Google Review or one of the other rating sites?
I would say I hear most people talking about Google reviews, looking at Google reviews, but also then Yelp as well. Probably those two sites are the ones that I hear people going to, but also using themselves to
Right.
rate
So if a
businesses.
doctor says to a patient, could you please go to X site to give us a review? What site do you recommend that the doctor send their patient to?
I would say primarily Google reviews,
Mhm.
right? Um, and yes, I just think inviting patients, if you're very happy with your experience, I'd love it if you'd consider giving me a Google review. Um, And I think, that of those, Only maybe a few will, but prompting people, especially people who are happy, um, you know, is going to lead more people to be able to do those reviews to counter the irked people. That there are some people that no matter what you do, they are going to be irked and unhappy, um, and go do reviews. But if you can bulk up the satisfied patients also doing reviews, that's important.
Right. Would you recommend that the front desk actually get the patient to give the review before they leave the office?
If that is possible, absolutely. If it may depend upon someone's level of uh, w- technological expertise, and how the doctor wants to do that. But absolutely, if someone is willing to do that review right there, it would be a great idea.
Um, why is this a problem for physicians? I mean, we did mention that, the reviews are, uh, a big aspect of it, and also retention. Is there anything else that makes it a problem for physicians?
Well, I'm sure you can attest to this, that physicians are people too. Uh, and right now, healthcare is probably, if not the most stressful, it's one of the most stressful times in healthcare people have ever seen, and it just seems to be building. And um, I hear a lot about physicians, talented physicians, leaving the field because of the stress in the work environment and incivility and rudeness, although it may seem like that's not really that consequential. If that's what you are dealing with every day in your work environment, or if you unwittingly are encouraging that in your work environment, it means you're unhappy to go to work. And we know that's going to have a negative effect on physicians physiologically themselves.
How does the physician actually encourage that?
You mean encourage rudeness?
Yeah,
You
how do
mean,
they incite that?
well, if they are unwittingly, I mean, what I say to people I work with, that, we need to be mindful. We all have our strengths as leaders. We all have the values that we espouse as leaders. But the reality is, all of us have stress-related negative behaviors. We all do. And the question is, are we aware of them? And that um, whether that sometimes people can be not aware of them, but be snapping or rude to their staff. Um, and or they may be aware but just be overwhelmed. But that unwitting stress-related negative behavior can ultimately be something that's creating the toxic work culture. So whether it's the behavior on the part of the physician, her or himself, or as you indicated, maybe it's an office manager or other staff members that they are allowing to behave in negative ways, those are problems for the physician practice owner.
Are there exercises that you can recommend to people where they can improve the interaction between staff members and the physicians?
I think of certainly reviewing material on active listening. So often we are listening to what someone is saying, but but we may be thinking about how we're going to respond already in our minds, and skills of active listening to really listen. Um, we are not as good at listening in our culture as I think we could be. So I think certainly skills around active listening. I would also direct your listeners to the simple strategy they can find online of the four-step mindfulness, which is basically stop, breathe, reflect, and choose. Stopping, recognizing the stop is recognizing when there's a negative emotion that has caused problems for them, like anger or irritability. And we all get angry and irritable. We all do. But it's like when you recognize that is overtaking you, stop, take a few breaths to sort of settle yourself if you can. Reflect on what is your behavior, what are you trying to avoid, and what's behavior that you'd like to be doing instead. And then the choose is to try to make a healthier choice. So stop, breathe, reflect, and choose. And people can also find a little bit more information about that on my website if they're curious.
And what is your website?
So for my coaching practice, it's activatesuccess.org. And if people are curious to know more about this book on rudeness, and there's lots of videos that people can watch for free, that's at rudenessrehab.com.
Well, that's, a catchy phrase that I think most of us can remember.
Yeah.
Can you now give our listeners two tips that they could implement right away, where they can combat rudeness on the part of others? It could
Okay.
be not only the staff, but encountering, a patient who maybe is rude because they're worried about the, like time crunch, or, they're worried about their diagnosis, and that's how they are responding. So how do you get the doctor to, like, soften them up
hmm
and get rid of that rudeness?
Um, One of the most challenging things I have found in my own practice is to try to stay calm when people are angry at us, and expressing anger, because we get tense and we want to lean back. And what I advise people is instead, and I try to do myself, is to be mindful of our, when someone gets really angry, be mindful of our own physiology and try to breathe and purposefully calm ourselves to try to stay calm ourselves. And when possible, literally physically lean in to indicate that despite the fact someone's angry, I'm not going away. I'm actually wanting to hear what's going on and see if I can help you. So recognize the message that your body is sending non-verbally and breathe. The power of breath. And there's a lot of different strategies people can use around breathing. I think the other thing I would try to, I encourage people to consider is the skill of compassion and trying with empathy, put yourself in that patient's shoes. It's hard to do when someone's really angry, but if you can see their behavior as they're an anxious part of them, or an angry part of them, or an unsettled part of them, and not personalize it, that they're not necessarily directing it at you, but it's about something else, and try to be mindful that people's behavior, even though it's directed at you, is about a whole host of other things going on in their lives.
Well, I think that's great advice. And I've really enjoyed our episode, as I'm sure most of our listeners will too. This has been another episode of Marketing Tips for Doctors with your host, Dr. Barbara Hales. Till next time.